I mean, it's a subtle one. Even if you don't pick up, you will not fail for this. But if you pick up, you'll be getting good extra marks.
The task in this station is to do a general physical examination in a 4-year-old child who was presented to the clinic. The images are representation of the obvious clinical signs that the candidate is expected to pick up when they enter the actual clinical station in their examination. It will be given, your task would be to do a general examination, and you will see a child, and I'll just let you know that the child is a short stature child. The child looks quite small for his age, quite short for the age. So yeah, when you enter into the station, you will see a child who um, they have given, although the age is 4 to 5 years, but the child will look quite stunted, quite small. So yeah, go on.
Hi, what's the name of the girl? Sorry.
Yeah, sorry, I should have provided that. Let's call her Rosie.
Okay. Yeah, hi. I'm Dr. Harshada. I am one of the pediatric doctors. Is this Rosie? And are you Rosie's mom?
Yes, yeah. Hi.
Yeah. So today I'm going to examine Rosie. I'm going to have a quick look at her. I'm going to wash my hands with a sterilizer. And I'll ask the mom, is it okay if I have a look at Rosie?
Yeah.
And I'll look at Rosie and I'll say to Rosie, is it okay if I have a quick look at you and listen to you?
Yeah. Rosie's alert, active. She's fine and she's comfortable in allowing you to go ahead.
Okay. So she looks well and she looks alert. Does she have any other supports?
No, there's no physical aid that she has come with.
Okay. Is there anything around her, or like any medications or any sputum?
No.
And this is how she looks.
Yeah.
Okay. And no mobility aids. And she is small for her age, isn't it?
Yeah, she appears. As you can see, general appearance, she appears quite small for her age, and she's also thin built, and she appears kind of undernourished, but there's no obvious uh, nutritional deficiencies that you can appreciate.
Okay. So I'll have a look at her hands. I'm looking for pallor on the palm. I'm looking for koilonychia on the nails. I'm looking for clubbing.
Yeah.
I'm looking for any peripheral stigmata of infective endocarditis like GNV lesions or Osler's nodes. I'm looking for flapping tremors. And um, I'm looking at the pulse. I'm counting the pulse for 6 seconds.
Yeah, so the pulse is regular, and the pulse is about 100 per minute, and there is a bit of there's a bit of pallor at the nail bed. No clubbing, no cyanosis, no stigmata of a chronic illness, no cannula marks or no scars. And yeah.
So now I will also look at the peripheral. I will compare both the sides of the pulses if there is any radial delay. And then I will go to the face. I'm looking at the eyes. I'm looking at the conjunctiva, and I'm looking for pallor. I'm looking at icterus. I'm looking.
So there's just conjunctival pallor, and the rest of the eyes is normal.
Okay. I'm looking at the mouth now. I'm looking for dentition. I'm looking at the tongue. I'm looking at the tonsil. I'm looking for any perioral angular cheilitis or any markers of deficiency.
So there is no evidence of any tonsil enlargement or any angular cheilitis. As you can see, it's just a normal oral cavity, and the dentition is also normal. The dental hygiene is also normal. Is good.
And any high arched palate?
No, there's no high arch palate.
Okay. In the eyes, I'm also looking for any abnormalities in the eyes, any coloboma or any blue sclera or any abnormalities.
No. So the eyes look normal on gross examination.
Okay.
Gross
Then
appearance.
Okay. I'm looking at the philtrum. Is it smooth or it is okay? Normal?
Yeah, the philtrum is normal.
Okay.
Yeah.
I'm looking at the ears. are there any deformities, and behind the ear there is anything, or any sinuses or anything?
No, no, no.
Okay. Now I go back and I look at the hairline, and I'm looking for any webbing of the neck. Is
No,
that no?
no.
I'm looking at the neck, any scars or
No, so the neck appears normal. There's no webbing. There's no
posterior.
posterior. The hairline is appearance is normal, and there's no um, I mean any contracture or any deviation, or in the back also looks normal.
Okay. Now I'm looking at her chest. Is there any deformity in the chest? Any asymmetry or any? I'm palpating for the apex. I'm looking for any dextrocardia. I'm looking for any scars in the midline or in the lateral sides, and at the back, or any potacath or anything in the chest.
No, so as you can see, the chest is normal in shape, size, and there's no scars or any devices that is cited there.
She looks small for age, so fine. I would like to see her arm span.
Right.
You said she is small for her age, isn't it?
Yeah,
Yeah.
yeah.
Then
So how
I
how
will
will
do
you
the.
how will you check for the arm span?
So first, I will take a full
Yeah.
height, and then
Sorry.
look
So
for the.
6 minutes is but I know you were describing in detail what you would be looking for, so we'll just allow another 3 minutes, and
Okay.
and we'll go ahead with that. Yeah.
Yeah. So I'm looking at the arms. I'm looking at the. I'll from the middle in the index finger to the index finger. I'll
Mm-hmm.
take the measurement and the height measurement.
Okay.
I- is the arm span more than the length? That is what I would like to know.
So the height is more. The arm span is less than the height.
Okay. Then I will do the maneuvers for short stature.
Okay.
First is you will put both the hands together in front with the palms touching to look for any asymmetry, to look for any
Yeah.
cleidocranial
Yeah. So
dysostosis.
there is when you look that for asymmetry, you can appreciate there is asymmetry.
Okay. Which is more and which is
So the right appears to be bigger. Right appears to
okay.
be.
Okay. Then I will look at the fingers if there is any finger deformities or anything whilst I'm doing
So
that.
so you can appreciate this one.
Okay. Yeah. Fine. Okay. Sorry, I was
Yeah.
looking at the big girl. Sorry. Yeah. Then the next maneuver is putting the hands on the shoulder, or rather the thumb at the shoulder, both bilaterally.
Yeah. Yeah. So there is no rhizomelic shortening there. The the child is able to make a fist touch the shoulder,
Okay.
and yeah.
Then I will look at the carrying angle.
Yeah. The carrying angle is normal.
Okay.
It's about approximately. Um, I mean, it's hard to measure, but there is no obvious increased carrying angle.
Okay. Then next I will ask her to make a fist right in front to look for any metacarpal shortening.
Yeah. So there is no metacarpal shortening, but as you can see, when she makes a fist, there is a bit there is a gap in the fist because of this.
Okay. There's only okay, but there's no absence of yeah.
No, no, no.
Okay. Then I will see her palm. I will look for any simian crease or
No,
further.
yeah. So yeah, you have
Then,
looked at the palm at the beginning, and there was no abnormal simian crease.
I will ask her to bend over, and I look at
Yeah,
the spine
fine.
at
So
the to look for
there
any
is
scoliosis.
no yeah. So the spine appears normal. There is no visible. You cannot appreciate any scoliosis.
Okay. Now I'll ask her to sit down. Um, and I
Fine.
think
So
I'm
that
done. Yeah.
okay.
Yeah.
So yeah, how if would you like to what would you
So what
like to do to conclude your exam?
to conclude my examination, I would like to take a full history. I would like to take a full set of observations. I would like to take parental heights and plot the mid-parental height.
Right. So when you do that, you find. So how do you
For the
how do you
girl,
calculate
yeah,
the mid-parental height?
it's mother's height plus father's height minus 7, or rather divided by 2 and minus 7 for girls.
Sorry, say again.
Mother's height plus father's height, half of that minus 7
Okay, fine.
by
So
calculation.
yeah, and then how would you plot it on the chart?
So on the graph, there is another column. There is a different thingy for mid-parental height. So there is one height for the mother, one height for the father, and then you draw a line across it, which the there is where it intersects. There is something like that. It's like a
Okay, we'll go through that. And
yeah.
and what range would you like to put for looking
So
at the
for
child's centile?
target centiles, you will add plus or minus 6
Okay.
for the mid-parental height.
Yeah.
And yeah, so these are the observations. Besides that, I can probably do blood pressure monitoring, look
Right.
for in urine dip. So in summary, I examined Rosie. She's a 4-year-old girl who looks well grown, but looks small for her age. And I would like to plot her on an appropriate height and growth chart. She
Yeah.
looks dysmorphic with a frontal bossing and a clinodactyly. She probably has a triangular facies and
Okay.
a depressed nasal bridge. She seems short for her age. I would also like to plot her head circumference.
Yeah. So her head
And
circumference is between the is just above the second centile.
more than the second centile. Okay.
Just above, yeah, just above that line, and the height is less than second centile, and the weight also corresponds to the height. So the weight by height ratio is normal.
Okay.
Okay. And so in terms of so what is your differential, and what investigations? How will you manage? What investigations would you like to do?
So that was an exceptionally well described, thorough examination how you would be approaching this kind of case. In the subsequent following video, we bring in the highlights of the discussion that followed. So let's see how that goes.
Here as well. However, Harshada, I would just like to comment one thing, that when you identify a child with short stature, comment. So you identify triangular faces. Try to make put that forward in the first instance, because I don't think you mentioned that in your
Yeah.
initial appearance. You probably put that in your summary.
Yeah.
Secondly, the growth charts. Don't be so late in bringing the growth charts. For the boys, I do add 13 to the mother's height, and for the girls, I subtract 13 from father's height, and then divide it by 2. But all the formulas same number. But the important thing is they want to check if you are able to plot it. If do you know the concept of mid-parental height, and if you're given the numbers, if you're able to put that on the chart or not. And then for the closing remarks, what you would like to do is you would like to, if it's an older child, you would like to assess for sexual maturity rating. You would like to do a Tanner staging, but younger child, don't mention that. And then you subtract that from the top, from the height you have got, and then you need to do a lower segment or upper segment ratio to make sure this is a proportionate short stature or a disproportionate short stature. And when you are testing for this asymmetry, also look for the clavicles, palpate for the clavicles at this point, because the child is bringing the hands closer. Okay. And older child coming in with disproportionate short stature, absolutely normal child, all normal examination. The only thing will be a bone age lagging behind. And you can get child with syndromes like Downs, Turner's, or these Russell Silver ones. Yeah. So these, yeah. So based on your findings, based on the specific case, you will include those specialities.
Yeah.
Okay.
Yeah. Thank you.
Yeah.